Hey, welcome again to the Life After 50 show. I'm Catherine Watson, and I'm here with Kathie Synder today, and we have got a good program for you. Something everybody out there, I don't care what age you are, where you are in life, what's going on, everybody needs to listen to this. Because one day it will affect you. If it hasn't already affected you, it will affect you one day. So we're talking about hospice and all of the myths and the misconceptions around that subject. But before we do, I want to just introduce our sponsor, and that's Find Houston Senior Care. Find Houston Senior Care is a web directory that helps families find the care and the services that they need. There are over 500 blog articles on the website with tons of information. All of the Life After 50 shows can be found there. So if you missed one in the past, you might want to thumb through and see what you missed out on, because we've had some wonderful speakers over the last couple of years and continue to bring in some really good speakers like Kathie today. And I'm going to just turn it over to Kathie and let her tell you about herself and why she got into hospice and why we're doing this program today. Kathie?
Thanks, Catherine. Thank you so much for having us, Compassus on, having me on. This is a great way to be able to get the word out to everybody. I've been on before in a different capacity, but I am now with Compassus Hospice. I'm absolutely loving it. Compassus Hospice has been around a long time, but hospice in general is near and dear to my heart. Coming from, I actually had a industrial background. I worked in a factory environment for 27 years and found myself drawn to the senior world. And I actually went into working, I was working in a senior living environment. And then I actually owned my own home care company for a couple of years. And then I eventually, most recently, was running an independent living community and was then recruited into Compassus because my father passed on hospice a few years ago, and my mother is currently on hospice. And they said that they could see it was in my heart, so they recruited me over to join, and I am so glad I did.
And I've known you for a while, several years now, and it definitely is in your heart. That I can attest for that. When I heard that you had made the move into a hospice environment, I thought, yes, that's perfect. That's the right place for her. And because you have the family background of having used the service, I think it makes you more compassionate, more understanding, more empathetic. You understand what families are going through, and you understand some of the misconceptions that they have. And that's what we're talking about today, these myths. So let's just dive right in, shall we?
Yes, please.
Okay, so we're going to start with myth number one. A lot of people say, I want to focus on life and living, and hospice is about death. I want nothing to do with it. Kathie, talk to me about that.
Well, I mean, that is a myth. I mean, the thing is, when I tell friends and family now, or not family as much because they understand, but some friends that I tell them I'm working for a hospice company, and they're like, oh, yeah, that just, how can you do that? Because you're working with people that are going to die. And well, let's first of all face it, we're all going to die at some point. Dying is a natural part of life. And what hospice is about is not focusing on the dying, but focusing on the life that remains, and making that as positive as possible, not only for the patient by managing their pain and their symptoms and their social, psychosocial, and spiritual needs, but also those of the family. And that's what was so keen for me and my family when my father was on hospice several years ago when he passed. Hospice nurses, first of all, are angels straight from heaven. I knew that immediately. And now that I'm actually working in this field, I can tell you that there is no one with a stronger love of an understanding for someone going through a terminal illness, and the steps they have to take psychologically to accept that, and having the skill set and having the experience of recognizing the needs that families and patients have as they're going through this end of life cycle is truly key to what we do and why we do it. It is not at all about focusing on death. I mean, very few conversations about the actual death. It's more about how do we make you comfortable, and what is it that you need in your life, and what does your family need as you walk this journey, and we walk with you.
Absolutely. Absolutely. Kathie, I want to stop you for just a minute. We're having a lot of audio background noise, and I'm not sure whether it's something you're touching with your hands or whether it's your microphone. Why don't I have you take off the microphone and
Okay.
let's see if it works better. Okay, talk now.
Is that better?
Much better, much better. I think people will be able to hear you and understand you better. Sorry about that.
No problem.
Yeah, it is absolutely a myth. In fact, a lot of times people find that they really enjoy life more and they live longer on hospice. Studies have shown that people live longer on hospice than not. So, it's definitely about living. And living to your fullest.
And that's a lot to do with the additional love and attention that someone on hospice gets, whether it's in their home or in an assisted living or a skilled nursing facility. Hospice is an additional level of care that adds to the attention they're already getting from one of those environments. And then if it's in the home, all the education that we provide to the family for them to be able to address any of the needs that come up between visits.
And that's something I want to point out before we get to myth number 2. Hospice is a whole team approach. So you get this literal team of professionals who are there to help walk you through not just the person who is dying, but also their whole family, because it's a family process. And you've got social workers, you've got nurses, you've got nurses' aides, you've got bereavement counselors, you've got chaplains. I mean, you've got a whole team. You've got a medical
director.
Medical director. I mean, you've got a whole team, and there's no other service out there where you get that. And it's amazing. And I will segue into myth number 2. Hospice care is expensive and will require co-payments. Let's talk about that.
That is absolutely a myth. I just spoke with a family yesterday, and unfortunately, they had been approached by another company who apparently did not explain to them that all of these services that are available, they thought it was going to be expensive, and how are they going to possibly afford a nurse and a social worker and an aide and blah blah blah, all those people you mentioned. And I said, no, hospice is a Medicare benefit. You've been paying it, you've seen it come out of your check for your entire life, and now you may as well use it to pay for these services. It's 100% covered, and it's not just those individuals that are covered. It's also any medical equipment that you might be needing, such as a bed or a bedside commode, or the supplies like the briefs and protection for your mattress, and then any medications that are associated with your diagnosis are also covered. So it's a lot. And that, again, we've all been paying into Medicare for a long time, and if this benefit is something that would help you, then take advantage of it. I mean, it's not that it's written in stone. It's not. I mean, if you get there and you decide for whatever reason, I can't even imagine, that it's not the right thing for you, then you just go off of hospice. That's not a problem. It's easy. And then later, If you want to come back, you can do that as well. So
yeah, and you get to choose the hospice company too. We'll
that's
talk
correct.
more
There
about
are
that.
a number of good ones out there.
We'll
Yes.
talk about that later. I want to bring up a couple of people. Elizabeth Hilbin says she's in court, but she's on her computer and she'll listen in. Thanks,
Hi,
Elizabeth. We appreciate it. Yes. And April Dennis says, good morning, ladies.
Morning,
She's
April.
also saying our audio is echoing really bad. April, let me know if it's still doing that. I'm hoping that we were able to fix that when we had Kathie switch out of the microphone. Hopefully you're not still having that problem. Anybody listening, let us know if there's any problems with that. We want you to have the best experience possible.
Yes.
So let's go on and hit the number 3. Myth number 3, pain is just expected. It's part of the dying process.
That is, while pain might be something that's expected, having to deal with it without any sort of assistance is totally unrealistic and not required. You should not have to be in pain. And one of the first things we do, or any hospice company should do when they come and do an assessment on you or your loved one, is to assess the pain level that they're at and make sure that there's adjustments made. At Compassus, what we do, we call it our Right Med, Right Time program. And oftentimes we'll find that patients have been to a number of different doctors and maybe they aren't communicating. And there might be conflicting medications or something that's just not really going to do any good anymore based on the fact that you've elected not to continue with curative treatment. And why put yourself through that additional medication if it's really not helping your situation? So pain is addressed at every visit because things happen. Something might have happened. You twisted your neck or your ankle or whatever between this visit and the last visit. And so it's assessed at each visit and adjustments are made. You should not have to live in pain. No.
And I want to point out something too. When my mother-in-law was on hospice, she had severe dementia. And her behavior would sometimes be pretty aggressive and not very happy. I just say it lightly, but at times it got worse. And once we got her on hospice, they assessed that most likely she was in a lot of pain and was not able to communicate that to anybody. She had rheumatoid arthritis. She had a lot of physical things that caused pain. And so once they got that under control, that really helped with her mood and her demeanor just tremendously. I won't say everything went away, but it did help a lot. So, if you've got somebody that has dementia, they may not be able to communicate to you. A good hospice company and a good hospice team will cue into that and understand and be able to work with adjusting those meds so that they can live the best life possible.
I've experienced that personally with my own mother. So she was being agitated and annoyed with everyone, and they made some adjustments to her medication, and she's just as happy as she can be. I don't know if any of you have seen my mother on Facebook. I do tend to post a lot about her. She's so darn cute.
She's adorable, and she just seems so happy. She's just so happy. And I love that. So
quick plug for the place she's in, Hands to Lend. I got to tell you, it's a fantastic personal care home.
Absolutely one of the best. Yes, if you're in the Cypress area, great one. It's on my care home list on Find Houston Senior Care. We have a whole list of residential care homes that I've vetted. I still suggest that you vet them also, but that's one of my faves. Yeah.
Absolutely. Actually, I think that Find Houston Senior Care might be how I found that one.
I think it is. Yeah.
So thank you.
Well, good. So number 4, when people are placed on hospice, they die within days.
Well, and I think you kind of touched on this a little bit in the beginning. This is absolute falsehood, unless people wait until the very last minute. And let's just be frank here. Hospice truly is a benefit to the patient and the family, but really only, I mean, well, it is regardless, but it's a better benefit if you're able to start sooner rather than later. The sooner that we are able to get people onto hospice and understand and address all of their symptoms and pain and manage all of that, oftentimes we can add up to 30 days of life to that individual. And, that's quality time that you can be spending with your family. I try to stress on that with the families that I meet with that are wavering whether they should do this or not, because they feel like if they put their mother or father on hospice, they're giving up. And truly, that is not it. Instead, you're giving life. You're giving hope. You're giving the opportunity to address maybe any underlying issues you might be having as far as spiritual or psychological. Get time to get in there and kind of work through these things. And very, very often, I mean, my mother, I know your mother-in-law was on for quite a while. My mother is approaching 3 years on hospice.
Wow.
So,
my mom was on almost 2 years. Yeah.
Yeah.
And we couldn't have done it without hospice. We could not have done it without the hospice team. They gave so much value. They really did.
It's so true. Obviously, there's benefit periods, and they have to be reassessed over certain periods of time. But my mother has, she's not improved in any way, but they've managed to keep her comfortable and sustain the ability to enjoy life for as long as possible. And
definitely happy.
Yeah, she's definitely happy.
Okay, so let's go to number 5. Hospice care won't allow me or my family to be involved in making decisions about treatment. And I can vouch that that's not true.
Yeah, that is absolute falsehood right there. Get that idea right out of your head. In fact, families are at the center. I have this little graphic. I don't know if you can see it or not, but this is the little graphic. Oops, hang on.
Yeah,
that shows the family is right in the middle. This is the whole team we were talking about earlier with the medical director and the nurses and the aides and all that. And the family is right in the middle of it. And that team acts as a blanket around that family, making sure that the patient and the family and the friends and the caregivers and anybody that's deeply affected by this is addressed and loved on and cared for and involved.
I remember when my first granddaughter was being born, and I desperately wanted to be there, right? But it was, it was a long way away, 12 hours away. And I was really worried about my mother-in-law. She had had a bad fall one night, and we didn't know, it was kind of touch and go. And I was very worried, and I didn't want to leave if something was going to happen with her. I didn't want to do that to her or to my husband. I felt they all needed my support, but I was torn. I really wanted to be there with my grandbaby being born.
Of course.
And the hospice team was wonderful. They came in that day before. They assessed her. They called me. They told me what they thought, that they thought everything would be okay and that I should plan on going on my trip. They assessed her again the next morning and called me before I got on the plane to assure me that everything was okay. They gave me updates while I was gone via text message and all. And that made all the difference in the world. It really did. It allowed me to be able to go and be with my daughter-in-law and see my first grandchild being born and, all of that stuff. So hospice really helped in that instance. And yes, you are the center. And when if you're on hospice and you need the team to get together, you just tell them. You just say, hey, can we have a team meeting? Because I have some questions. They'll pull the team together and let you talk and help you get the answers that you need.
And that's not just between 8 and 5. That's 24/7. That's every day at any time.
Absolutely. Absolutely.
I don't know how many times.
I love number 6. This I hear all the time. Hospice is a place. Everybody thinks that it's a place you go to.
No, that is not correct either. That hospice is a service. It's a benefit, again, that you've paid into for your entire life, that you've been working. While hospice can be provided in various places, it is not actually a place itself. It is, in fact, a service. And it's a team effort. And jumping back to what you were just saying, I don't know how many times I've had overnight conversations with the nurse when I needed help. And it's not a place. It is a service, and it's a fantastic service.
Yes, it is. Okay, myth number 7, rolling right along here. If I choose hospice, I'm giving up and I can no longer go to my physician. That was a big question in my family the first time we had experience with hospice, when my dad had had a major stroke. And the family was torn. No, we don't want that service because he won't be able to use his physician. Tell us
that. That is not true. In fact, our medical director will work directly with your physician to put together the full comprehensive care plan. We always need information from your doctor to make sure that we have a comprehensive care plan. There are some instances, though, I will say, that your personal physician may opt for our medical director to take control of that care plan, and then we just basically keep your doctor updated on how we're doing. That being the reason being that if your personal physician signs up as your attending physician rather than our medical director being your attending physician, hope this isn't too confusing, then that means that your doctor has to be available 24/7. And oftentimes they're like, no, we'll let your doctor take care of it. Just keep us informed. But the reality is, if there's any time you want to go to your own doctor, absolutely, you're welcome to. You don't have to lose contact with your own doctor. We want them involved as much as they want to be.
And I might also point out, if something happens, like when my mother-in-law had the fall, she was on hospice. The home called us. It was the middle of the night. Of course, they always fall in the middle of the night, right?
Right.
Your mom, they can never fall in the middle of the day. It's always middle of the night. So here we are in the middle of the night. We're not thinking straight. We tell them, yes, send her to the hospital. We're going to meet you there, blah, blah, blah. We get in the car and I go, oh, she's on hospice. I don't know if we're supposed to go to the hospital. I don't know what we're supposed to do. So I called the hospice company. They said, that's fine, and we will send somebody there to be with you. Oh, my word. Let me tell you, that was invaluable. This hospice nurse showed up in the middle of the night at the hospital, and she sat with us because we had to wait quite a while. And when it was taking way too long, she went and hurried things along with the people in the emergency staff, and she helped us to make decisions. She didn't make them for us, but she helped us to make the right decision. And at the end of it, we decided to take her back to her home, her residential care home where she lived, and hospice cared for her. And so it was great having that extra support and knowing that we have the choice. It's our choice. If we had said, yes, we want them to do surgery on her brain, they would have done it. We could have let them do it. But we didn't have to. And she, in a very gentle way, helped us to see that it probably wouldn't have been a very good decision had we made that decision for her. She was 89 years old, extremely frail. It just wasn't the right choice for her at that time. So, but again, they didn't choose it for us. She just asked us questions and helped us to make the right decision.
Yeah, and then she probably let your mother-in-law's physician know all about it.
Yeah, exactly. Exactly. So great. Now, here's another one, and I've heard that before too. In fact, I've told people, yes, you can fire your hospice company if you're not pleased. Myth number 8, all hospice companies are the same.
Well, I'm finding out that is not true at all. I've personally switched a few patients to our care from another from another companies, and found that people are blown away with the fact that we are truly 24/7, and the education that we provide and the assistance that we provide. And it kind of surprises me that not all of the hospice companies do that. In general, all hospice companies will have a medical director and an RN and an aide and a chaplain and a social worker, and should have volunteers available. But I think the difference is in their philosophy, and finding one. I believe ours is really good. I know there's several others out there that are very good, that have a holistic approach that includes all of those disciplines. And their main number one focus is, what is your greatest concern today? How can we help you today? And that's not just the nurse asking, that's the aide asking, the chaplain asking, the social worker asking, the RN. Everybody's asking that patient and their family, how can we help you right this minute? What is your greatest concern? And we understand that a patient may tell an RN that pain is his or her biggest concern. They may tell a chaplain that they'd like to have communion. They may tell an aide that their bed's not comfortable, et cetera. And all of this can happen in the same day. But if only one person's asking that question, then you're not addressing the whole situation. So I think if you find a company, make sure that they have a philosophy that is all about not just person-centered, but family-centered, and truly all about a holistic approach to managing the pain, managing the symptoms, managing the greatest concern of whomever they're talking to.
Mm-hmm. I agree. And, it's a personal service. So you need to connect with the people. You need to ask questions. Don't just accept that the social worker or the case manager or the doctor or somebody said you need to go with this hospice company. A lot of times people will be in a hospital situation, and legally, I think they have to give three.
I think they typically give.
Yeah,
at least three.
But a lot of times what I've heard from families is, though they gave them three, they pushed them towards one. And usually it's because there's a financial connection there, and that hospital is, connected with that hospice company in some way, or the person who's referring is connected with that hospice company in some way. Do your due diligence. This is a service that you may be on for a long time. Like I said, my mother-in-law was on for 7 months, my mom on for 2 years, Kathie's mom almost 3 years. It could be a long time. You want to get a company that you're comfortable with. So interview and talk to several different companies, find out the different philosophies, ask questions. Give Kathie a call, ask her questions, pick her brain. She has a lot of information and a lot of help. Watch shows like this where you get the information you need and you know what questions to ask. I'm going to put your phone number up here right now, Kathie, because some people listening to this may want to reach out to you and talk to you about a situation that they have. Now, one thing I want to point out is you have to be approved to be on hospice, but that said, a lot of times your doctor isn't going to think to recommend it. So you may have to bring it up. You may have to say, I'd like to get mom evaluated for hospice. Okay. Usually the doctor's not going to push back. Some doctors are more comfortable with hospice than other doctors, but let's face it, they're trained to heal you, to fix you,
right.
To do whatever they can to make you heal again. And that isn't always the case. It's a cycle of life. We're all going to die at some point. So it's the choice of how do you want to die.
Exactly.
And that's what hospice is about. It's about letting you have that choice. So again, this is Kathie's number, and I'm going to spell it out because this will also go to my podcast. So Kathie Synder can be reached at 713-825-2619. And if you want to find out more about Compassus Hospice and all of the things that they offer, they are a national company, by the way. So if you're listening from another area, or maybe your loved one lives in a different area of the country, go to compassus.com. It's just Compassus, not Compassus Hospice.
Correct.
Correct. Okay. Compassus.com. And you'll get a lot of information there. But the more you can educate yourself, the better off you're going to be.
Definitely. Definitely. Well, I appreciate the opportunity to be here today and share, help you bust some of these myths. I hope that it was helpful. Please don't hesitate to call or reach out to Compassus or myself, and or whatever hospice company you've heard of, and make sure you're researching and asking all the right questions. If you're not sure what the right questions are, you can reach out to me for that. Just, talk to a few before you make your decision, and best of luck.
Absolutely. Absolutely. Thank you, Kathie, so much for being on the show. And we'll be seeing you next week. I've got another speaker lined up that you're going to want to listen to. But again, I'm not going to tell you. You're going to have to wait and see. So join us next week for the Life After 50 show, and we'll see you next time.